Hello, and welcome to the third installment of World War Z in Public Health. So we've covered most of the movie by now, or we will after this segment here. We have one more week left, folks. So next week, next Monday, September 10th, will be our last episode of World War Z in Public Health. My intention is to continue on. I want to look at other moments in Hollywood. That's why I'm calling it Hollywood in Public Health. That's the name of the segment overall. But this was just exploring World War Z. So my intention is after this, after next week, I will post other possibilities or direction I'll be taking it with looking at Hollywood and how we can use these fictional, type of scenarios or movies and actually apply it to real life. What can get us thinking about how we are in our communities to keep them safe and as professionals. So with the third segment today, we are covering chapters 9 through 12. We started in this segment with minute 55, and we end in 1 hour and 22 minutes. And we leave off with pick up Jerry in Israel again with Jürgen, an Israeli official. And we end with Jerry at the WHO, or World Health Organization facility in Wales. Okay? So right now, Jerry is in, which is Brad Pitt's character. He is in Israel talking to Jürgen. We ended with that, and he's trying to get more information about the email that they intercepted from India. Okay, so the email they intercepted from India, that communication was the first time we heard of the word zombie. Okay. And he is trying to figure out where patient zero is. It didn't work out with trying to find what he thought was patient zero in South Korea, but now it's possible that it goes back further, that they have one that goes back further to India. And Jürgen says, forget about patient zero. Okay, India is a black hole. Never mind about patient zero. You need to move on from here. And Jürgen says, I don't have all the answers. Okay, I don't have all the answers. All you can do is find a way to hide. That's what he's telling Jerry. So that's not, again, this is another one of those moments, not terribly far-fetched in the realm of public health, right? When we don't understand something, when we've encountered viruses that we're not really quite sure about, what do we end up doing? We kind of end up masking the symptoms, or if it's an animal, clinical signs, until we figure out what we're dealing with. HIV and AIDS is a prime example of that. Until we understood what we were dealing with, we gave medications and therapies that simply treated the symptoms from it, right? So it's funny how these different things jumped out at me, and I thought, in the realm of public health, that's not that far-fetched. So he's telling them, basically, I don't know what it is. I don't have all the answers, but just hide. Okay, so ride it out. And in the book, which is, of course, I've brought up repeatedly, the movie is based on, which is Max Brooks' book, World War Z. That's brought up repeatedly, that they got to a point they realized we can't fight this, so we're going to let it play out and then rebuild civilization. That's in the book, that's what it's about. And they talk about letting it ride out to the point that people moving north, that it would hopefully freeze these walking corpses, right? These zombies, freeze them. And then they can move on from there. Figure out how they're going to get rid of them, decimate them, and rebuild civilization. So the book covers that in a different angle, but covers that kind of philosophy that Jürgen gives into too. Okay, so we know there's a fortified wall around Israel. This is how they're only letting select people in, and this is how they're keeping the diseased people out. However, it becomes breached, right? And if you guys remember why? It was sound. And we had a definite introduction to the fact that sound has a tendency to draw these walking dead, these zombies, when Jerry was in South Korea. But now we're getting a full picture here of how much sound pulls them. We get a lot of theatrics, a lot of Hollywood special effect, with really trying to hammer the point that sound, not a good thing, it brings them in, okay? So in the midst of all this, they get pulled in. We get introduced to a new character, which we find out later her name is Sagan. We don't know this yet. She's a female soldier that's trying to help, Israeli soldier trying to get Jerry out of there. Because when the walls were breached, can't think of another way to put it here, but all hell broke loose, right? They're everywhere. And in the midst of this, of trying to escape, we come across two interesting characters, which they don't have a name, but Jerry makes note of it, okay? One was an old man where all the zombie creatures go running past him. Ha! Sound familiar? Right? Goes running past him. Then we have another one where it's just like a young man. His head is bald. His head's been shaved. And the zombies, or the Walking Dead, kind of go around him like a rock in a river. Okay? They circle around him. The kid kind of panics. His way of panicking is to go down almost into a fetal position on the ground, but upright, as they go around him. So Jerry's still observing. All this chaos, pandemonium is all happening around him, but he's still trying to observe and take in what exactly is taking place. What is he noticing as these Walking Dead are now everywhere? As these zombies are everywhere, what is he noticing? So something not so good happens. The UN plane that Jerry came in on leaves, right? But we find out Jerry gets an opportunity to really test his 12-second observation. What I'm referring to as the 12-second rule. He really gets an opportunity to test it. So Sagan, again, we find out her name later, in the midst of trying to protect Jerry, along with the other Israeli soldiers, she is bitten by one of these creatures. Oh boy. She's bitten in her forearm, right? She's bitten in her forearm about here. And Jerry quickly thinks what to do. So what does he do? He takes like a machete or a knife, and he cuts off her arm above where the bite is. And he counts. He counts to 12. He counts very quick to see if she changes. She doesn't change. So then he kind of grossly, rudely wraps up the arm, the stub, and says, let's get out of Dodge, right? Interesting part there, folks, right? Because he's believed that 12-second theory, even though in South Korea, with the SEALs, they said it for them it was longer, which was earlier cases, right? That they said, oh, it takes 5 to 10 minutes for this change. Jerry's really putting a lot of stock in the 12-second rule, and he is doing an interesting treatment, so to speak, right? Now, I mentioned this before, and I make a lot of comparisons because I'm not surprised in Max Brooks' book that they make a comment about calling it rabies, because there's a lot of similarities. And as soon as I seen this movie, watching World War Z, I thought, are they going to come out with it at one point, rabies? And I was really shocked that we didn't really hear that other than in the first 2 seconds of the movie. But in Max Brooks' book, it comes up frequently. As a matter of fact, as I said, they call African rabies, you'll see off and on throughout the whole book. And they say that because someone had said rabies in South Africa, and they put the two together and called it African rabies. Without going too far off the beaten path here, that's pretty typical. With avian influenza or any influenza viruses, strains in there somewhere typically is the place where it was found, that strain, okay, in the name. So it's not, as a layperson, we might say African rabies, but in the professional world, we do that, to some degree too. So he's kind of basing it on, he may not think of it as being rabies when he does this, but if you remember what I told you guys last week, is that if I'm bit up here in my shoulder and someone else is bitten in their foot, okay, with the rabies virus, the person, it takes longer to go from the foot, we'll say, to the brain. It takes longer for symptoms to materialize. The closer it is to the brain, the quicker symptoms materialize. That's if it goes untreated, okay? So in this case, it's kind of being loosely based on this. It's cut off above where the bite is, hoping that she's not going to turn, that she's not going to become one of these infected creatures, right? Okay, so now it's not just him trying to run to get out of Dodge. Now he's trying to save her life too, So she ends up sticking with him. They end up getting aboard a commercial airliner, and they get the heck out of there, right? Now, there's a lot of other stuff in the movie, a lot of other parts of it that are, you know, they're theatrical. It's a really good, interesting, like, pulse, quickening moment of the movie when he's in Israel in these chapters 9 through 12. But sticking to public health, you know, we pull out the main part. Now we're on the plane. Sagan's on the plane. Now, another theory is tested in this part. You know, chapters 9 through 12 is really an imperative part that we're testing a lot of the parts that Jerry and Theory, remember Theory is the UN secretary, that Jerry and Theory have commented on in the movie. Now we're really testing those waters. So we've tested the 12-second rule with Jerry. Now Theory commented that he believed that what made the disease spread so quickly, do you guys remember? It was airline travel, right? So now we're here, we're on a commercial airliner, and what happens? We end up having some stowaways. They don't know that there are some infected persons on this plane. So again, there's a lot of Hollywood theatrics, but it ends up having a breakout on the plane. Before I take that any further, there's something I just want to bring up that I thought was rather interesting, again with the public health aspect. When Jerry gets on there, before all pandemonium happens on the plane, okay, we get like a microcosm on the plane of what's taking place on the ground, right? But before that happens, Jerry's talking to Sagan. Sagan's saying, well, how did you know that this was going to work? He's like, I didn't. I'm saying in so many words, I observed it and I tried it. Because it was, for her, it was all or nothing, right? But then he treats her wound. Guys, remember, he used like vodka as like an antiseptic. And some bandage material from a first aid kit, and he quickly cleans and bandages up her arm, her stub, of where he had amputated off her wrist and her hand. So he's treating the injury that's from his treatment, okay? Then all hell breaks loose on the plane. The plane crashes on a way of when he figures out, he talks to Theory, and finds out where the closest facility would be to them that could make a vaccine, virus vaccine. And he's directed to WHO, a World Health Organization vaccine or a medical facility in Wales. But going from where they're at in Israel to Wales, that's when they find out they have these stowaways that are infected, which the last week we talked about infection on planes. I discussed about ships in the earlier days, so now we're proving theory. And the plane inadvertently ends up going down because Jerry has to use a grenade to basically kill as many of those suckers as he can because they're trying to attack him and they're in a plane. It's like they can run. The plane goes down, now they're in Wales. Okay? I'm going through this rather rapidly because I'm going to assume you guys have seen the movie at some point. So if there's any comments you want to add of anything I missed, please don't forget down there. Put your comments in there. Okay, so Jerry and Sagan land in Wales, and the part that I noticed right off the bat, it's definitely quiet. You see people poking out windows, but nobody is coming out. Is looking out, and especially with seeing strangers, you know, that would be a signal to me that something happened there, right? The movie doesn't show it, but definitely in Jerry's observation skills, it catches his attention looking around. Now, when Jerry arrives with Sagan at the WHO facility, which is about where we stop at, he has an injury from the plane that has definitely jeopardized his life. It could jeopardize his life if he doesn't get treatment. And he loses consciousness at the WHO facility, and we see him wake up, and they're questioning who he is and why he's there. Okay? That's basically in a nutshell. The only part, you know, there's a lot of theatrics in this part. Lots of Hollywood. It makes, like I said, edge of the seat, kind of pulse-quickening moments going on in this aspect of the movie. The only thing I didn't mention in there was that Jerry has to prove who he is to the doctors And so they call theory, right? That's really the complete end of chapter 12 there. Now, if it was a real life facility, he probably would have never made it in through the front door. Especially, we find out later, without going into detail, because I don't want to spoil it if you haven't watched this part of the movie yet, but you typically wouldn't have a facility that has the type of viruses and plagues and things on site that someone could just walk right into. But that's Hollywood, right? And then he has to prove who he is, and what does he find out? That his wife's no longer on the plane because they're no longer essential person, or on the aircraft carrier, because his wife and family are no longer essential personnel. Remember that phrase was used at the very beginning of the movie? Are no longer essential personnel because they think Jerry died when the plane went down. Okay? So that's everything pretty much in a nutshell of what's taken place in chapters 9 through 12. It's not as much to cover as the other parts because there's so much theatrical stuff in there. But before we go on, remember the routine we have. So before we go on to looking at laypersons and professionals and what can be taken from that portion of the movie, we're going to talk about symptoms. What did we pick up from this part? So, chapters 1 through 4, which was the very first segment we had of World War Z and public health, we found out about the symptoms of aggression, aggressive behavior, cannibalism, and highly focused on the next meal. I made some parallels, and I've done it off and on, to the rabies virus. We find out about Jerry's 12-second observation that I refer to as the 12-second rule. We talk about who's affected, not affected, or infected. We talk about the gentleman that ended up going through the vehicle, right? That's how we find out about the 12-second rule. And we start to get an idea that anybody looks or appears sickly, it doesn't seem to be affected. And in this case, in this part of the movie, it's the homeless gentleman that is sitting on the street. We see all the other Walking Dead creatures run past him, right? Okay? We find out that you cannot acquire the disease through ingestion or fomites. And the big ingestion part of this was when Jerry was in the stairwell. He's got the gun holding back one of the zombie creatures, and he ends up getting blood from it in his mouth, and he doesn't acquire the disease. So he can't ingest it and transmit it, okay, and acquire the disease. And we can't get off fomites. We can't get it off of hard surfaces like countertops, wherever they've touched. Otherwise, everyone would have it. So far, we're not seeing that, okay? Well, the next segment we covered in chapters 5 through 8, we looked at Dr. Fosbach's, which wasn't with us very long. We looked at his quote that seeing crumbs for the clues that they are. And Jerry, that's how he started really focusing on the smaller details of things, right? So we find out that it's rapidly spreading. That Theory, which is the UN secretary, says about it spreading to all corners of the globe. That's when we hear about the theory that Theory thinks that it's because of airline travel is why it spread so quickly. We hear from a group of doctors who believe it's a virus. We find out from the SEALs that as opposed to Jerry seeing a person that was bitten and showing symptoms, it took 12 seconds. The SEALs in South Korea said it took 5 to 10 minutes. So this would be much earlier cases. And I talked about how, that could be a sign of something, some sort of mutation. I gave the example of in the movie Outbreak with Dustin Hoffman, how that virus had mutated from requiring direct contact to airborne. So this could be a situation that mutated, or it could be like rabies, that it depends on where you were bitten, right? We find out they're drawn to sound. And again, we talk about on the bottom here, who's affected and who's not affected or infected. And we look at more situations where someone appear to be sickly and they don't acquire it, right? So we moved on from here. And this is where we are today. Now, the phrase to me that stuck with me on this movie that really hit the symptoms and the signs that we're seeing are from Jürgen Warmbrunn, and that was the Israeli gentleman that Jerry's talking to. He says all he can do is find a way to hide. And like I had commented on, that's not that far-fetched as far as public health goes, because there are diseases we encounter, we don't even have a name. There's actually a virus called No Name. You guys can more than welcome to Google that. I thought that was rather interesting. So what we end up doing when we can't find a cure for something, we try to make it more comfortable for the person that has it. Sometimes it'll come later in the life cycle of a virus that we refer to as palliative care. So they're getting something that simply makes them more comfortable because we can't treat the disease or get rid of the disease itself. Okay, so that is not that far-fetched. That's actually pretty close to when we're not familiar with something, what we do. So we confirm it's absolutely attracted to noise, and I know I had that on the last one, but the reason why it stood out with me, how sensitive they were in chapters 9 through 12, was in the last chapters, it could have been that it's closer proximity. Okay, because it showed them in South Korea, the phone that had gone off. Remember, Jerry's wife had called him, and it triggered those that were close to come running. This was pretty Hollywood-esque, right? They heard the noise from the loudspeaker, and they were climbing over the wall. They were using each other as a pyramid to climb over the wall to get into what they thought was fortified. So this is even a step up from how it looked before. Okay, that they're definitely attracted to noise on a very sensitive level. We see that Jerry tests the 12-second theory on Sagan when she's bitten. And, you know, it was an all or nothing situation. So he decides to try to cut her wrist and her hand off, which would be above where the bite was. And let's count and see what happens. Okay? We find out the weakness of airline travel. We prove this theory. So looks like we've proven the theory correct from Jerry. And now we're looking at Theory's theory about whether airline travel has affected the transmission of this virus. And lo and behold, they have stowaways. Even as loud as they seem, as fast as they seem, they were able to get on the plane undetected. And there we go with another possible transmission route. So Theory's theory appears to be proven. Okay? And then who's not affected or infected? So in this case, now this will get us up to 4 people that we have signs of that they appeared to be ill or sickly, and they avoided them. Okay, I was going to say like the plague, but they avoided them. We have the older gentleman that was the first one in chapters 9 through 12. That was the first one they went around, and the young man that had a shaved head that went down like in a panic, almost in a fetal position, and they ran around him like a rock that's in a river. So we are up to 4 people now. So far that we got a lot of potential evidence of that for some reason those that appear to be sickly or elderly the people that are infected with this don't want anything to do with them. Okay? So what's Jerry thinking? We'll find out in the last, because on Monday, September 10th, we will cover the rest of the movie. So you'll look at our from 1 hour, 22 minutes to the end of the movie. And we'll talk about, Jerry puts everything together of what he thinks this is and what he believes we're going to do. And this phrase by Jurgen, all you can do is find a way to hide, stuck with him right till the end. Very imperative quote here that Jerry takes just about literally to try to fight back against this virus. Okay? So, we've covered our symptoms. We covered what the movie, what we've seen during that time. Now we're going to look at 3 topics. We're going to look at 3 topics from the perspective of a professional and from a layperson that we could have extracted or taken from this portion of the movie. So what's our three items this time? So we're going to talk about responding to emergencies as 1. 2, attracting a disease, which we definitely don't want to do. And 3, treatment inadvertently causing disease. Okay, so that's the 3 items we're going to cover during this segment. So when we talk about responding to emergencies specifically, and I've kind of covered this on some level off and on in bits and pieces, now I'm going to cover 2 particular points in regards to responding to disease. So I've mentioned this system. We have a system that we use for if we have a large scale response, if we have a lot of organizations, government bodies that are part of a disease response. We use something called NIMS, which is a National Incident Management System. Okay, so this is a way to create a framework so all of us can work together. And having been part of an outbreak as a professional capacity, if you don't have this in place, like I can't even imagine how it would be. I can't even tell you. Because you have all these people coming together that it could be someone with the same type of position in multiple agencies. So what do you do then? Do you want them all vying for the same position at the disease response? Of course not. So this NIMS system really helps people to work more cohesively and really helps all of us to come together so we're not trying to decide who's doing what. It makes us meld a lot easier. And all bring our attributes, our gifts, whatever skills we've had in the job to bring it together so that we can help the public as quickly and as efficiently as possible. Especially with a disease response, what we don't want to do is while we're trying to figure out who's doing what, the disease grows. Okay, so this is a really a quick way for us all to come together and decide what we're going to do. So there are two things I'm going to talk about with this that really is handy in NIMS that I can extract from this movie, okay, that pertain to disease response. So one is common terminology, and the other is operational periods. So common terminology. How many different ways have we heard? We've heard the people infected referred to as zombies. We've heard them referred to as the Walking Dead. In the book, in Max Brooks' book, okay, we hear Zeke, and in the movie we hear Zeke too. Zeke, we hear ghouls, we hear water ghouls, so we hear all of these names. As far as it goes to the disease, the disease spreading itself, we hear plague, that's said. We hear great panic, and we hear the walking plague. So all of these names that we all have for it made me think of two things, okay? Outside of NIMS, it made me think of the show The Walking Dead. Remember, if you guys have seen the show, which is, again, is a really great public health show. It's not just the fact of responding to disease itself, but it's how everyone responds and reacts to it themselves, which I just find absolutely intriguing. But they have all these names for the people that are infected, right? Depending on which region, as the show has progressed, depending on which region they have come from, they each have a different name for what these infected persons are called. Can you imagine the type of confusion that would cause in an outbreak scenario? If this was real life and I'm talking to somebody else and we're using totally different language, can you imagine how confusing that would be? So I want you to think about something. So I have this, okay, you guys can see what it has. I'm going to give you a second to look at it, and then we're going to talk about what it means. And there's a different language in there, which I'm going to cover in just a second. There's a symbol, and there's a couple abbreviations, okay? So I have j'adore, a triangle, a 4, this says DZ, and this says PREV period, okay? So what am I trying to say here? Well, I'm saying I adore like, j'adore is French, okay? I adore or like, change for, that triangle means, can mean a symbol for change, okay? So change for is probably the most obvious thing on here. And then this DZ pre-REV is disease prevention. So I'm saying I adore or like change for disease prevention. What happened if you didn't know French and you're looking at this? What happened if you didn't know the triangle, that symbol meant change? Then you talk about things like DZ that may not be the same in one profession or another. Okay? I can give you an example with human medicine and with veterinary medicine. There's abbreviation of SX. Okay, so S is in Sam, X is in X-ray, so SX. Okay? So in veterinary medicine, SX is surgery. In human medicine, it's symptoms. Okay? So when you talk about all these professions coming together, remember I've made different parallels here to One Health. I think it's really important that human health medicine, veterinary medicine, and environmental or ecological thoughts all come together. It's called One Health, so that we try to keep our community or niches safe, right? As healthy as possible. So if all these professions are coming together in a disease response, and we each have a different language, oh boy, okay? As if the pandemonium, as if the chaos, that hopefully is organized chaos, as if all of that isn't enough, and then we each start speaking a different language. Not good. Not good, okay? So NIMS, that National Incident Management System, a component of that is that we don't do that. So that's why I wanted to bring that up, that if we're following the NIMS system, okay, so this is for professionals out there. If you are looking at your someone in a municipality, you're in disease response, public health, doctor's office, maybe you're thinking about getting involved in disease response. It's really important we all speak the same language, and the NIMS framework requires it. And I can tell you, especially as a government employee, as a former government employee, it is really confusing when all those acronyms get thrown around. Okay, so that's an important component, is that we all use the same language, and the acronyms and abbreviations are kept to a minimum. So seeing that and then hearing it in the book, and then thinking about like shows like The Walking Dead, where it's in real life, but this is something that's mimicking real life, that it's very accurate, that how important it is for us to speak it. Now, as laypersons, I'm going to tell you that this is, and I'm going to speak to you as my professional opinion here, it's a good idea for you to learn as much as possible. When doctors ask you, or veterinarians, or each of their associated staffs, are having you described what your pet is doing, or what your health is doing, what concerns or complaints you have, try to use common language that you learn. So when the problem is that when you use language that's not understood by the medical profession, things can get misinterpreted. Okay? So this is why it's important we're all speaking as close to the same language as possible, and that we're all as clear and as concise as we possibly can. We don't want to leave too big of a margin for interpretation. Now, there's no way, it's impossible for me to speak exactly like somebody else. It's not going to happen. I mean, that'd be weird, first of all, like Stepford Wives. But you want to get as close to the fact that we're all speaking the same as possible. And especially in a situation where you're seeking medical attention, you want to be as concise and as accurate as you possibly can be, so the person on the receiving end understands your concerns or your complaints. Okay? So keep in mind, like I have here, where I have French, a simple, these are all true, by the way, folks. This is not something that I just decided to throw some things together. That we all speak the same language. When I worked at veterinary clinics, especially places that I was in charge, I was a stickler. I had an approved list. Many hospitals do this. I had an approved symptom, or what we called clinical signs in veterinary medicine, or abbreviation lists that we were to use. You were not to use anything off of that, outside of that, because the problem was I may not interpret it the same way. Okay, I may not understand or use it the same way you are, and then we have a massive problem that could lead to greater medical issues. Okay, so we looked at here common terminology. Now, what about operational periods? So when we're talking about responding to something, typically under NIMS, if we're looking at an emergency response framework, operational periods are times that you're working against trying to control a disease outbreak, for instance. You're looking either for 12-hour time or 24-hour time. Really important. You try to plan too far off, you're in trouble, right? You become scattered. So it's trying to keep you concise and controlled, that you're looking at it and you're going from either 12-hour to 12-hour or day to day. That you're trying to figure out who you need, what you need, and what your next step is going to be for the following operational period. Well, we see them get hung up on this a few times in the movie, where they're either trying to think too far ahead, or they don't have enough information to plan for that, what I would refer to as operational period. Okay? So I wanted to hit those two things. So the operational periods and trying to plan and I made a comment in the last, our last segment about planning, and I told you guys about ready.gov that can help you plan for your families at home and what to do. Let's say if there's an emergency where your kids are at school, your spouse is at work, and you're at home, what do you do? Where do you meet at? So planning's good, but you don't want to get, if you're in the middle of an outbreak, get too far ahead that in a situation of that you're trying to plan for something that you can't plan for. Okay? And we see this hang up throughout the movie over and over and over and over again. Okay? So, what's our second? Number 2. So we talked about responding to emergencies. Now we're going to talk about attracting disease. Well, there's something interesting that I wanted to bring up here. Now, when we talk about health, okay, when we talk about public health, we're talking about trying to keep a community healthy. Not necessarily trying to completely get rid of disease, because especially there are many diseases that are endemic or that are in a community for multiple reasons, so you aren't going to completely get rid of them, but you're trying to keep the community as healthy as possible. Health helps to ward off disease. So it's important that we try to stay as healthy as we can. Well, there's a report in many communities. If in your area, it definitely would be a good thing for you to look this up. I could find it for my area. This is the District Health Department number 10. You can see that here. Community Health Assessment. Now, the reason why we call it the Health Department number 10 is in my area, our health department is regional, and it covers 10 counties. Okay, so in my area of Michigan, it covers Crawford, Kalkaska, Lake, Manistee, Mason, Mecosta, Newaygo, Oceana, Wexford, and Missaukee counties. So that's why it's District Health Department number 10 in northern Michigan. But they assess, they called people, okay? They called people in this assessment and to see, well, what areas do you think you need to improve on? What do you think would help to make your community healthier? So for Mason County, they broke it down to adults, older adults, and children. And for Mason County, which is where I reside, the top 3 for adults were health insurance does not cover dental services, cannot afford visits to doctor, dentist, clinic, and or hospital, and the third is health insurance has high deductibles and or copays. For older adults, it was cannot afford visit to doctor, dentist, clinic, and or hospital. The second was health insurance does not cover dental services, and third was transportation issues. For children, the first was cannot afford visit to doctor, dentist, clinic, or hospital. Second was health insurance does not cover dental services, and third was finding a dentist. So we see this common denominator of concerns for people in the area for determining what they think they need to maintain health in their community. And the one common denominator in here was access to a dentist, between all 3. We know that having a healthy mouth, having healthy gums, having healthy teeth can affect other things or other areas of your body like your heart. So it is a big deal that we have access to appropriate dental care. So this assessment, if you look up your health assessment for your community, I'm speaking to you now as a professional, this can help you ward off disease. So if an outbreak was to occur where you're at, what can affect the community overcoming it? The health of the community. If you have a low vaccination rate, if you have a low rate of people not responding by going to their doctor, what could that do? What could that do to them, to your community overcoming that disease outbreak? So it would be very helpful for you as a professional, and I'm speaking to not only human health here, but veterinary health. Find out in your area where the concerns are for weaknesses in health. We are only as strong as our weakest link. So if we have high rates of people not vaccinating their kids, if we have high rates of immune-compromised people in the area, there are some areas that have higher cancer rates than others. These are all things that overall affect the health of a community, right? Now, the movie doesn't go into specifics as this, and this is one of these things that as I'm watching it, this is the stuff that is going through my head. And if something like this was to really happen, now, of course, it's, not going to be like this. Even with the flu in 1918, it wasn't Hollywood-esque like this, right? But it's determining, well, what things could affect the health and welfare of a community. When we talk about Typhoid Mary, who was a group of people that she definitely affected. She was a carrier of typhus, right? Typhoid. She's a carrier. She's a cook. And it was children. So, you know, who in your community is the most vulnerable? In this case, by this assessment, it's helping me as a professional to look at where people think the weakest link is. And in this case, in our area of Michigan, the weakest link could be the fact that we don't have, either can't afford or don't have access, depending on the age, to a dentist in our area. So that definitely could be something I would look at as a professional. So look up to see what your assessment is for your community to help determine what you can do to improve it. So another question was asked in the assessment was, what can we do in our county to move closer to our vision of a healthy community? So I mentioned what, you know, takes away from health. These are things that people feel like in Mason County, for example, that could be added to make us a healthy community. And they named 8 things. Okay, so they said create an environment that supports healthy lifestyles, improve behavioral health and substance abuse treatment through early intervention and trauma-informed community approach, foster a culture of collaboration, increase access to affordable housing, improve community education for adults and children, provide consistent employment, education, and training access, increase affordable, accessible healthcare options, and improve access to public transportation. So let me ask you, out of those 8 things, have you seen any of them in World War Z? I would say quite a few. We've seen a homeless man that's in there. We've seen people we've questioned whether they've had transportation to get out. We've seen an environment. Does the environment support a healthy lifestyle? Did we see a substance abuse issue? Yes, we saw someone drinking in the movie. Was there a culture of collaboration? Kind of iffy, right? These are all things in real life we have to be concerned with. So the movie mirrors, you know, it's not like I'm trying to extract the Hollywood out of it and leave the stuff in there that it can give us an example of things we can improve upon in our own communities. Okay? As lay people, you need to speak up. You know, just as you hear the mantra, vote, 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 right? Don't sit back and let someone else dictate where you think your country needs to be. Vote. Well, this is the same for the health and welfare of your community. If you see things that need to be addressed, one of the best places to start is your local health department. Ask them what programs they offer. If they don't meet your needs, the needs of your family or your community, then speak up. Things don't change. Money is not allocated unless they know that there's a need that it can address. If it's not told, then it's not allocated. Okay. Another way we help with this is when we do our surveys, our census. The census helps to determine what programs are available. In other words, where money goes for in a community. If we're not partaking in those, then the money doesn't go there. Okay. So those are ways we can actively participate in the welfare of our community, okay, of keeping our community as safe and as healthy as possible. So there's number 2. What's number 3? Treatment that can attract disease. Now, while I'm watching this, one of the big things that popped into my head was infections that are resistant to antibiotics. And although this is a virus, I couldn't help watching it. You know, when you're trying to figure out what disease you're dealing with, you know, in real life, how would we assess the fact of how the overuse or incorrect use of antibiotics could contribute or affect a community from overcoming an outbreak? So the WHO, okay, so that's the World Health Organization. I pulled this off of their website back in February this year, 2018, and it was released in January. So I pulled it off when it was rather new. It's WHO, World Health Organization, releases its first report on global antibiotic resistance. So they collaborated with, they had all these countries collaborate and give their input and provide information on where they believe there's issues with resistance in their communities. So in the first report from the WHO's or WHO's Global Antimicrobial Resistance Surveillance System, or they call GLASS, data from 22 countries and more than 500,000 isolates show that and they name these ones that they're concerned with. Escherichia coli or E. coli, Staphylococcus aureus, Streptococcus pneumoniae, and Salmonella species are all ones from this report that they go, yep, we've got a problem. Okay, things that we could treat, we're no longer able to treat. Of the 52 countries currently enrolled in GLASS, so again, this is the Global Antimicrobial Resistance Surveillance System, or GLASS. Of the 52 countries currently enrolled, 40 provide information on their surveillance system, and 22 provided AMR data. So AMR is antimicrobial resistance. So they actually provided data from their country on AMR, on the resistance, okay? The AMR data provided by 22 countries are primarily for pathogens isolated from blood. So pathogen is anything that causes disease. It's a very broad term. Are primarily for pathogens isolated from blood, urine, stool, cervical, and urethral specimens, and show a tremendous range in the proportion of bacteria that were non-susceptible to one or more of antibiotics commonly used to treat them. So, long story short, things that used to treat the bacteria that came from those areas of the body or those fluids, they're not working now. One of the ways we test for that is called a Kirby-Bauer test, which we're looking at for resistance. We're looking to see if I have this isolated, this bacteria, and if I apply this this antibiotic, does it work? Okay, and this test helps us determine, especially in cases where things typically work, it's not. It helps us determine which antibiotic can be used. Resistance to penicillin, for example, ranged from 0 to 51%. So it could be up to 51% of cases that penicillin used to work is not working, okay? While resistance to ciprofloxacin in urinary tract infections, or what's called UTI, by E. coli range from 8% to 65%. Ciprofloxacin is the drug most frequently used to treat urinary tract infections. So what some people call Cipro, okay, ciprofloxacin, it could be up to 65% of the time it's not working. Not good, right? That is not setting up a community to be as healthy as possible at all. Not working. Not a good thing. So the WHO is trying to put this together, this report of